This afternoon, our conversation centers around a cancer uptick involving Asian American women, a growing number of lung cancer cases, and the diagnosis often seems to come completely out of nowhere. Joining me now is Dr. Heather Wakely, professor of medicine and chief of the Division of Oncology at Stanford University. She's also the deputy director of the Stanford Cancer Institute. Thank you so much for being here.
Thank you for having me and for covering this really important topic.
It is an important topic, and you actually approached Dr. Scarlett Gomez, who we met in the last block, about what you were seeing in your practice among Asian American women diagnosed with lung cancer. What were you seeing?
We were noticing in clinic that many of the patients coming in were presenting they'd never had a smoking history, and many of them Asian American. And so really wanted to try to understand the why of that. We started looking at the question about why are people who've never smoked getting lung cancer, and then have really focused on how that might be different in different Asian American communities, and just kind of built from there. And we had been talking for a long time about doing this type of a trial that became the van study, a case control trial where we're really able to ask the questions as opposed to just looking what's already been published, but really generating some of the new information as well.
Now, it's important to note the study is still ongoing, so the final results aren't out yet. But what do you think is behind this uptick?
I think it's likely going to be multiple things.
Okay.
We do think that there is some kind of genetic risk, but we haven't been able to identify it, and we being the global medical community, because many people have looked. But we know that the rate of lung cancer for people who don't have any history of smoking cigarettes is highest in Far East Asia, and then kind of gets lower as you move west. In the U.S., of course, it's going to vary based on the people who live in the area where you are. So there's some sort of genetic risk there, but we also think this uptick is a lot of it's related to air pollution, and there's been some science clearly linking that, but there's a lot that we still can't specifically say it's had this or had that.
And it's specifically Asian American women. Is there a hormonal component to this? Why not Asian American men?
It is actually in both men and women, but it's much more in the Asian American women. Part of that, and I'm going to try not to get too technical, but we know that a lot of the lung cancer that develops in that specific group of people has a mutation in a gene called EGFR. And that gene is the driver for lung cancer for many people who get lung cancer, especially in that history of non-smoking, and especially in Asia. So it's Asian Americans, but it's also in Asia that this phenomenon is being seen. And that tends to happen more in women than men. We don't know why, and that hormonal link to it is something many people have looked at, looking at, is it estrogen, is it progesterone, is it some combination? Perhaps linked somewhat to progesterone, but not in actually causing more of that. So the Women's Health Initiative was a long ago study that looked at hormone replacement and showed a lot of things, but one of the things it showed was those risks of lung cancer weren't necessarily higher, but the cancers might be a little bit more aggressive when there was a progesterone component, but we don't have a great answer.
Now, what do you think is behind the recent uptick? Recent meaning the last 15 years. Is it because you're just getting better at finding lung cancer, or do you think that there's something going on that's leading to more women getting lung cancer?
We think there's actually a true increase in the incidence in the people actually getting the disease. There's been some great global work, especially in Taiwan, where they could show that even though smoking rates were coming down, the rates of adenocarcinoma, a specific type of lung cancer that we see, it's the most common, but especially the one seen in people who don't have a history of smoking cigarettes, that was shooting up dramatically, especially in the women. Here, we don't collect as detailed information on the smoking history to be able to answer that from the epidemiology questions as clearly, but in work that's been done, we are seeing that increase also. Screening, finding it earlier, is something that we are not very good at, especially for this group of people. So we don't think it's the screening, because we just aren't doing lung cancer screening for people who don't have obvious risk factors. So we think it's really going up, and that's why it's such a significant public health issue.
I want to go off that, because so many of the women we spoke to don't find out they have lung cancer until they're in stage 4. Why is that? And the symptoms don't really present themselves until it's such an advanced stage.
Right. Lung cancer is silent disease. We think about it that way for a lot of reasons, but especially because it can grow without any symptoms. there aren't really pain receptors in the lung, and so you don't feel anything. If it happens to grow close in where it can cause a cough, that could be a symptom. But a lot of times there's just no evidence that it's there until someone has, some people get lucky and they have something else happen which leads them to get an x-ray and boom, it's found. But a lot of times people don't come in until they're having later symptoms such as pain because it's gone somewhere else or really significant cough. So that's the challenge, and it's one of the big things we want to work on also is how do we find these cancers early? I mean, we want to figure out why they're happening. We want to stop them from happening. And if we can't do that, at least find them early enough that we're able to cure more people.
There's so much that's being done in this particular field and the advancements that are being made each year. We're going to have you stick around for one more break, and we're going to talk about the exciting treatments, and hope is on the horizon.
Thank you.